Nearly 40% of children under the age of 6 are living in households below the food poverty line. This has been revealed by the South African Early Childhood Review 2024. The report further states that the number of children at serious risk of malnutrition has increased by 500,000 since the onset of COVID-19. For more on this, I'm joined by Senzo Hlophe, Director of Partnerships and Impact at Ilifa Labantwana. Senzo, appreciate your time. Thanks so much for speaking to us. Just point out to us some of those key areas that you've found out from this report before we unpack other issues.
Sure. Good afternoon, Hugo. Thank you for having me, and good afternoon to the viewers themselves. Hugo, it's quite a glaring report, if I can put it, even more so now in the context of having the opening of Parliament tomorrow. At the high level, the South African Early Childhood Review, what it really does is tracks available information in the public to ascertain the status of our children in South Africa. And really what the report is saying is, since COVID, we haven't really done well to the benefits of our children. As it stands right now, quality early learning is unequally available to the children of South Africa. About 40% of our children remain outside access to crèches or any form of early learning opportunities, but also existing services like child support grant, which will be available to all poor children, is currently not available to all South African children that are deserving of these opportunities because of many reasons. Even within the healthcare space, Hugo, what we are seeing happening is access to quality healthcare services for both the mom and the child is currently dwindling. And this speaks to challenges that is mainly faced by children who live in the informal settlement in the townships, but also children who mainly live in the rural setting of our country. And unless if we do something about it, it's really gonna catch up with us in few years down the line, when this generation of today, which is meant to benefit from those services, is now struggling to attain further services as they go on by their lives.
Senzo, you raise the issue of all of this catching up with us, right? Now, when we talk about 40% of all children under the age of 6, right? I mean, that's a significant number, right? Paint a picture for us when we talk about the poverty line. What are some of the other things that these young, innocent children are deprived of?
Sure. So I guess it starts early, Hugo, and it starts as early as access to maternal and child health services for children under 2. And what we see there is about 1 in 4 children are nutritionally stunted. What that means, Hugo, is that children are not growing at the right age for their height. And this is linked to them not having access to adequate food. This is already happening when they're still little babies and growing up. And by the time we get to the age 3 to 5, where they're supposed to transition from a home setting into an early learning site where they can get some stimulation and child care, so that the women that look after those children are free from that care work to go look for other opportunities, is what we're also finding is about 40% of those children, they do not have access to it, because South Africa currently does not have I guess what I would call universal access to comprehensive early learning services across the country. So that is happening as early as age 3 to 5. That's already children are falling behind. Where we begin to see it showing its ugly head, Stephen Hugo, catching us up with us, is by age of grade 4. What we're already seeing in South Africa is that 80% of our children cannot read for meaning, because the foundation has not been solidified in our context. And obviously, we see this happening from there to about 40% of our matriculants not making it to matric. And we're seeing that with high unemployment rates. We're seeing that with low growth economy, if you judge by the average GDP per capita from 94 to 22, which averages about 0.7%. All of this, Hugo, it begins with making sure that the foundation is strong, that the foundation is solid. And I think that's where we missed a step in the country in 1994 in investing in universal access to all children's services in the country. And I think 2024, it's giving us an opportunity responsibility to reset, to make sure that we take the right step moving forward, so that by 2034, 2054, we won't be having these conversations.
So here's a number, 10 million tons. Now, that 10 million tons, Senzo, speaks to the amount of food that goes to waste every year in South Africa. So we produce 31 million tons of food annually, right? And a third of that goes to waste. Surely there could be a plan that could be made to mitigate that loss and deal with the 2 out of 5 children that are living below the poverty line.
Yep. So I think it's a compounding factors, Hugo, linked to the wastage of food. I think the one part is the cost of living in this country is really high. And the poverty households are living below the food poverty line, many of them, and they rely on grants as a way of getting by on for day-to-day needs. So if those grants are below the food poverty line themselves, like the child support grant, it means they can't afford the basic foods that they need. So I guess is part of the solution that I think we need to look into in the country as a mechanism to make sure we reduce the number of food that get wasted to the tune of 10 million tons that you talk about, is we need to look at making critical, essential foods available at a low cost price. And I think if as a country we make that commitment, that will reduce that wastage to a higher number. That's number one. And I think the second part of reducing the cost of that food is about distribution networks. So already there are existing platforms that distribute food, and they partner with retail companies to distribute food that is soon to be out of shelf life. But the challenge there is its networks to distribute, it's the cost of distribution, it's the communications channel to enable quick, rapid response to both access and deliver those foods before they reach their shelf life. So I think as a country, we need to look not just within the states, but look at public-private partnership mechanism that can enable those interfaces in a much more radical way.
But is that not an easier problem to have, the problem of distribution when you've got the food, as opposed to allowing 2 out of 5 children to suffer in this manner?
In the one part, I will say it is, but I guess the challenge is food industry or the food systems is quite a highly regulated space, both in terms of who is liable. So, for example, if I run an NGO that takes food from Retail X and distributes it to homeless people or to children living in homes or in households where they can't afford food on the day-to-day basis, is who's liable if I get food that is not of quality or good enough for people to consume. So I think and our laws that govern how food get distributed is quite strict. And I think part of it is reviewing those laws in a manner that obviously it protects consumers, it protects the already vulnerable members of our society, but also enables where that there is a potential to limit the wastage, we should be able to. But I will agree with you that for me is a simple one, but it's about looking at catalytic intervention other than starting anything new, because the resource is already there. It's about how we get it from the points where they go off or where they reach their sell-by date to people. And that's all we need to do.
Senzo Hlophe, Director of Partnerships at Impact at Ilifa, Labantwana, taking us through that. In fact, those horrible statistics, 2 out of 5 children under the age of 6 are living in households below the poverty line. Now, private